Hi everyone, this is Andrea Clayton. I'm presenting my Health Informatics practicum and review of the Portfolio Gen application for HAP789, Dr. Green Lawson. I decided to do the evidence-based research paper in light of the COVID-19 pandemic, which pretty much squashed my chances of doing my clinical practicum. My topic is the treatment of heart failure patients with a mid-range ejection fraction, which will be a comparative study with a small community-based cardiology practice. In addition to the evidence-based research, I'll be doing some data analytics with the small community-based cardiology practice. I'll basically be taking his patient data and cross-referencing it with the evidence-based research I'm doing for published articles. I'd like to thank Dr. Mariano Chudawape and his staff at Potomac Cardiovascular Consultants in Woodbridge, Virginia, for allowing me to do this. Just to give you some background on heart failure, it is something that over 6 million Americans suffer from. It is a well-researched area of cardiology. Heart failure can be categorized by the pump quality or ejection fraction, which is usually determined by echocardiography. So when we diagnose someone with heart failure, we'll also annotate if they have a preserved ejection fraction, which is one that's greater than 50%, a reduced ejection fraction, which is less than or equal to 40%, or a mid-range ejection fraction, which is between less than 49% and equal to or greater than 41%. The outcomes for these patients of the mid-range ejection fractions are not well known or studied in patients of this classification, and the treatment varies. So in speaking with Dr. Chudawape, he pretty much treats the mid-range people as if they had a reduced ejection fraction. But according to evidence-based research, they do not have better outcomes from this treatment. So using the cardiology practice data, I'll be analyzing the patient data from the practice using ACC and AHA guidelines. This research may assist in treatment plans for the patients with heart failure and mid-range ejection fraction. By eliminating some of the variability limitations, this practice's patients may benefit from a more targeted approach. So some of the limitations with research has been the fact that when you have an echocardiogram with an ejection fraction, it is variable by technician, it's variable by reading physician. So by only studying one practice's patients, we eliminate both of those things. It would be only one technician and one reading cardiologist. So we have a more consistent reading pattern. On to the Portfolio Gen. Here's my link to my portfolio. So I set up the first page with my name and title, and I used Health Informaticist / Data Analyst because this opens up much more job opportunity than just data analyst. But I wanted to put that in because that is our concentration and our main focus of our program. And then I chose leadership philosophy over career branding. I think the leadership philosophy tells a little bit more about my character and a little bit more about me personally. And you can get all of my work-related ideas from my resume. In addition, on the first page, I added a headshot just to personalize it so people can kind of connect a name with a face, and just a little blurb about my experience. And to the right of that is my leadership philosophy continued. And then at the bottom of the opening page, I rounded it out with education. So it listed my undergrad and my graduate degree here at George Mason. The next page would be work experience, which reads off of my resume. And then for the resume, I also included the cover letter and the drop-down box here, so you can access both. Some items to add on with a paid subscription that we weren't able to do here with the free subscription is a thank you letter, sample work, references, and letters of recommendation. I think the sample work is important, especially with our data analytics concentration. It really can show and showcase our abilities and the different things that we can do with data. References is a nice place to contain all of your references. And letters of recommendation are nice. I've only encountered 1 or 2 job descriptions that ask for letters of recommendation, but I think I'm going to go ahead and reach out to a few people and get a couple just to have them kind of tucked away and there if I need them. My review of the portfolio, Jen, is I feel like it could be useful for professionals to highlight the work. Like I said, the sample of work is nice, especially artists, like graphic artists and things can use that to showcase their talents. I feel like this is somewhat obsolete in the era of LinkedIn. I believe that people are 99% more likely to look at your LinkedIn page than they are a portfolio. I think maybe if you were in the last days of them deciding between a couple of top candidates for a job, they may research you a little further and look at your portfolio. Or if you're in more of an type of or line of work that it behooves you to have a portfolio. I didn't find that it was the easiest to use. It has a confusing interface with a bunch of stuff in it that's distracting and unnecessary. I don't know if the paid one is any better, but I didn't particularly care for setting it up. And this is just a reference for some of the information I gave you on the ejection fraction and heart failure information. So thank you, everyone. I wish you all the best of luck. I'm looking forward to seeing your work and your capstones.